My name is Dr. Michael Murray. I'm one of the consultants in Neuro-Intensive Care in the Institute of Neuro Science in Glasgow, and here we are in one of the neurosurgical theatres at the moment. Devastating is the short answer. The punch itself may be enough to actually damage people. It may cause trauma and it may cause a concussion. Very often what happens is that the patient loses consciousness, they get knocked out, they're taken by surprise usually, and they drop to the pavement. Most people are roughly 6 feet. By the time you drop your skull on the pavement, it's probably travelling about 13 miles an hour onto a concrete floor. The brain doesn't like being dropped. As I always say to people, you wouldn't drop your laptop on the floor from 6 feet. Dropping a brain on the floor is a computer that simply can't be fixed. The problem is that the brain can swell, it can bruise, and it can bleed. Well, often if people fall on the ground, they can fracture a skull. The skull fracture itself can tear veins, or it can tear arteries. Bleeding can then build up inside the brain, and the skull can't expand. So once the pressure builds up inside the skull, the brain cuts its own blood supply off. This can happen either very quickly, or it can happen, over a number of hours. So often people, especially if they're drunk, they go home, feel okay, and the pressure builds up, and they can potentially die and are found dead in the morning. People can lose consciousness. They can what's called contuse the brain, which is basically bruise the brain, and the brain swells up as well. So what we often have to do is we often have to bring people in to get emergency brain surgery. We have to often take a bit of skull out, sometimes take blood out, and sometimes resect people's brains, because that single punch has been enough to drop someone on the floor, smash the head, swell the brain, and in order to save their life, we have to remove part of that brain and part of the skull. And unfortunately, very often what we're doing is we're removing part of them as well. So the longer term complications are not just the physical disability, which might be things like having a stroke, unable to walk. Some people are unable to speak. Some people are unable to feed themselves. Some people are blind. A lot of people have memory losses. A lot of people have personality changes. They can become very disinhibited. And some of the longer term complications as well are epilepsy is a common one. People develop post-traumatic stress disorder. They are afraid to go out. They're more likely to develop depression. Depression is more likely to be resistant to treatment. They're more likely to become addicted to drugs. And there is often some evidence that there's an increase in crime in people who've had head injuries. So all of these things collectively can result in people in reality taking their own lives in some cases as well. There is an increased incidence. A single concussion can double the risk of suicide at 6 months. So, and this scan behind me, this is a scan of a patient who had been punched once in the face. They fell over, landed on the side of the head, and the white material you can see at the side is blood. That shouldn't be there. The brain is also squashed over to one side. What we had to do then was to do emergency brain surgery, take a part of his skull off, suck out the blood. He was still in hospital 8 months later. He's not able to work, he's no short-term memory, his marriage is broken down. That's a disaster. Alcohol is often a universal factor. About 90% of violence is associated with alcohol in terms of head injuries. And it's usually either, commonly both are drunk, but it's very unusual to get two people hitting each other who were both sober. I don't think in 13 years I've ever seen a sober head injury coming in. Look after your brain, you don't get another one. Keep it sensible, keep it above the pavement, keep your hands in your pockets. Often it's drink that causes it, and I think we have to be out for a good time, but not a dangerous time. No one wants to cause harm, no one wants to permanently disable people, or in fact be permanently disabled themselves. Those are the inadvertent consequences very often of just getting one drink too many, being a bit disinhibited, and results in tragic consequences.